Hello, 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 and welcome once again to Lunchtime with Dr. Nadine and our very special guest today. Her name is Dr. Andrea Thomas. Dr. Andrea Thomas is a pharmacist, a speaker, and a depression breakthrough strategist. She holds a Doctor of Pharmacy degree, but Dr. Andrea believes in a multifaceted treatment approach that addresses underlying issues often overlooked by conventional treatment models. She's dealing with a topic that most people are afraid to speak about, ashamed to speak about, ashamed to be associated with. And so, Dr. Andrea, we are so excited to have you here with us today. Welcome.
Thank you so much for having me, Dr. Collins. I'm really excited to be here today as well.
Awesome. And so, ladies, as you're here with us, kindly let us know in the comment section, in the chat, where are you joining us from for lunch today? We'd love to know who's having lunch with us, but we also want to know your location in the world. And so, Dr. Andrea, thank you so much for making the time to be here with us. So tell our listeners a little bit about your background.
Sure. I currently reside in Maryland, which is affectionately referred to, for those who are not from this area, the DMV, which stands for the District of Columbia, Maryland, and Virginia. And I've actually lived in all three areas. And by profession, I am a clinical pharmacist. I've worked in managed care, specialty pharmacy, home infusion, hospital. And I love health. I love the profession. I love working with students. And I enjoy sharing how being healthy and healthy tips does not have to be boring, and how it's actually liberating. And it has so many benefits. So I'm hoping that we can dig into that today.
Awesome. Great stuff. So thanks for coming by here. We're excited to have you. And so now we have you here, featuring you here today because you came through the speaker program. I know that we've never met in person, right?
Correct.
Okay. So what brought you into my world?
A friend of mine had shared one of your sessions or master classes where you talk about being a speaker and using your voice. And I had felt a tugging in my spirit to do the same. I forgot to mention earlier that I work with my local church and have been on mission trips, sharing health, doing programs at my church, small talks at my church, clinics, programs, weekends. And I had wanted to expand doing that. So when a friend of mine shared with me about this program that you were doing, that session, I attended and I said, I want to do it, but not now. And I tucked it away for a year or so. And then finally I was like, I can't deny this feeling that the Lord is pushing me and urging me to take a step forward. So I scheduled the discovery call with you, and we went from there.
Awesome. Awesome. So you're already doing speaking. You feel that call. What did you think you were missing? Because you're already in the space, right? What was missing for you that was preventing you from really just launching totally in?
I wanted to talk about health and some of the struggles that I have navigated and share the tips and things that I have learned and the strategies with others. But I felt that I wasn't clear with being able to put that all together and share that with others in a package that would make sense, or a platform that would make sense, bringing all these facets together. So I felt I needed some help with that, and also navigating, promoting myself in social media. I thought those were areas, and you had the experience, and you're a Christian woman helping other Christian women. So that just really gave me so much more confidence in working with you, and that this was the right approach for me.
Awesome. Awesome. So you wanted greater clarity, I'm getting,
right,
and just having that okay, this is it, because the health space is so filled. There are so many people speaking on various topics. We find a lot of it out there, and I believe when we met on that call, you did express your desire, to be in that health space and so on. And I believe I would have shared, we kind of want to zero in on which aspect of health that you are going to focus on, that's going to set you apart so that you can now become in demand.
Exactly.
what you probably thought it was and what God actually revealed. Did these two things come together?
They actually did, not in the way that I thought, though.
Mm-hmm.
So first I said health, and you were like, that's too broad. We need to be more focused. And then we streamlined it into talking about depression. And I was
Mm-hmm.
like, Lord, that's not the angle I wanted to take with this program. But with your certified prayer counseling course that you offer with this program, and through prayer, and you had said to us, prayer is your business strategy. I woke up one morning, you said, God will download it to you if you follow the steps and you were sincere and you're committed. And I woke up one morning and I just had a download, just as you said, where God showed me that the things and the strategies that I wanted to talk about, I could still talk about them through this platform of depression and show people the benefits on other illnesses and ailments as well. So it did come together.
Awesome, awesome. I'm asking because I know sometimes it takes us such a long time to get to where God wants us because we have our own preconceived ideas of what we want to do. And in your case, I know that you are a pharmacist.
Correct.
And so give us a little bit about your background. You know, you're a pharmacist, a little bit about your journey, because what you're doing now almost would contradict the work that you're doing. And so I know it must take a lot of courage from you to be able to now help people use unconventional ways. When we read your bio, we were talking about, you these unconventional treatment models that you actually are using to now help people to
Right.
deal with a topic, a situation.
Right. So
Deal with.
actually, yes, I'm working on my certification in integrated pharmacy, which is actually taking holistic and other strategies and incorporating them with pharmacy to
Mhm.
expand this platform and show how the two actually can work together. You know, in
Mhm.
treating depression, the mainstay in the Western model is medication and counseling. And some people just do counseling and some people just do medicine. And a lot of
Mhm.
people have just become ingrained and just think about that, and they don't explore other options, or they don't think there are other options, and their healthcare providers don't share other options and other
Mhm.
strategies. And in navigating my own journey, I learned that there were a whole lot of other things that you can be adding to that. And
Mhm.
what happened to me was I got burnt out with pharmacy school and then doing 2 residencies back to back, intense
Mhm.
programs, a lot of demands. And the stress and the burnout was the setup for me
Mhm.
getting depressed when a conflict came.
Wow.
And then I was on medication for many, many years, over 15 years. And initially it worked, but then they just kind of wore out. And
Mhm.
I wasn't thriving and I was
Mhm.
exhausted. And I went to a wellness center trying to fix another issue, a digestive health issue. But in correcting that and learning some of these other remedies and strategies, I realized that off of the medication after the detox, when I got home, and they recommended going to a vegetarian or plant-based diet. I was so focused on trying to implement the plant-based diet, I forgot that I had stopped my medicine. I never started them. And then weeks passed and I was like, wow, I feel so much better off of
Wow.
the medicine. And then it was on. I was so motivated to keep this going. So I started attending online conferences and learning these strategies and realized that there's a direct link between your digestive health and your mental health. And that
Mhm.
by working on my stress, my sleep, my diet, intermittent fasting, doing all of these things, I was actually addressing the depression by
Mm.
multi-facets and incorporating this into a lifestyle. I was able to, I learned about an anti-inflammatory diet, and implementing that, I was also able to get off my medication for back pain. So I was seeing benefits across the board.
Wow, that's powerful. I mean, you said you were on depression meds for like 15 years. You're pretty young. And so which means that you said you did your residencies back to back, and I remember your story. And I believe one of the things that really when I would have read your story as you went through the program, was the fact that I think there was this one day that you went into a pharmacy, but instead of you being behind the counter where you actually
Right.
give medication to somebody on the other side, you found yourself
The
being the
patient.
customer, the patient. What was
Mhm.
that like for you that day when you recognize, well, this is it?
I was in my second year of residency, and a conflict in my life occurred, which really sent me in spiraling into depression. And
Mm-hmm.
a coworker noticed and offered some encouragement, and I went to see a doctor. And at first, I was so resistant to taking medication, but then I decided I need some help. I need some support. I want to
Mm-hmm.
finish this program. I was actually encouraged to quit the program because of the stress. And I said,
Wow.
no, I've come too far. I've worked too hard. And I went to the pharmacy, and it was a pharmacy in the health system where I worked. It wasn't the exact pharmacy where I worked, but I
Mm-hmm.
recognized people in there who I had met, and I was filled with extreme shame and anxiety because I didn't want anybody to know. And I
Mm-hmm.
was looking around, does anybody recognize me? What is that person going to say when I get up to the counter and he sees it's me taking an antidepressant? Is he going to smirk? I was sweating. I was very nervous. I quickly took the bag and shoved it in my pocket and briskly walked away. I didn't want anybody to even see me coming out of the pharmacy to think, well, what is she doing in there? What is she getting? And I just can't imagine that I'm the only one.
Mm, right. Yeah, because you had that stressful schedule. About how old were you when that happened?
I was 25, 26.
You see, and I ask about your age because a lot of times when we think about depression, we're not thinking, in your mid-20s, this is something that you could be affected by, because
Right.
there you finished your doctor of pharmacy program, you're now doing your residencies, and you were living a highly stressful life.
I really was. I really was. And then I took on a very stressful job after that and just kept going from job to job. And, professionally, overall, I was doing well. My
Mhm.
life was doing well. I bought a house, I bought a car. I even started a business at one point. I was a pharmacy director at another point. So, on the outside, people would think, oh, she's young, she's fine, everything's good, she's attractive, she seems to be doing well. But emotionally, I wasn't
Mhm.
thriving. Emotionally, I was suffering. It was difficult to get up in the mornings. It was difficult to get going. Some days I just lacked motivation and didn't want to do things. Some days it was hard to concentrate, And again, I know I'm not the only one.
Yeah, that's amazing. I really want to just applaud you and acknowledge you for just being bold to just share that, because I know it must be taking a lot, to just come
Yeah.
out here today and just share all of that with the world, And so now you came into the speaker program. What would have been the biggest breakthrough for you? Because I know you didn't intend to speak about depression. The Lord led us there. We began to do the work. What was the biggest breakthrough for you in the program?
That biggest breakthrough was the prayer class, and also the runway to soar. In addition to they complemented the speaker mentorship program so well,
Mhm.
and if you invested the time in those, God was showing you how he's going to direct you through this process. And even though it was a little scary, and it still is scary in some respects, because some colleagues may think, oh, you're going against pharmacy. Oh, I wanted to make this point. Actually,
Mm,
in pharmacy school, we spent a lot of time and a lot of emphasis on counseling patients, because a lot
mm,
of times the doctors don't have the time and they consider us the drug experts. And I've even had patients come to me and say, my doctor said to be sure to ask you about this medicine and how to take it and what to look out for, because there's some specific things that are really important. And with that, we were encouraged or taught not to just talk about the drug therapy actually, but what
mhm,
to consider non-pharmacologic measures, which are
mhm,
complementary things, but often
mhm,
those get lost. I mean, we do it for diabetes. We encourage you to lose weight, to exercise, to change your diet. We do it for hypertension. But when it comes to things like mental health,
mhm,
except the counseling, pretty much nothing. People don't talk to you about, a high sugar diet, and sugar addiction is a real thing, and it's actually a common thing.
Mm-hmm.
It can, exacerbate depression when you don't get enough sleep,
Mm-hmm.
when your digestive health, if you're not moving your bowels on a regular basis, if you're eating foods that are laden with chemicals and toxins, if you have trauma in your life that's unresolved, I found out that I had toxins that were contributing to my digestive health. I had high levels of glyphosate in my system. I had high levels of phthalates, which are from beauty products. I had to change the beauty products to cleaner things because that
Mm-hmm.
was all affecting my digestive health and in turn affecting my mental health.
Wow, I mean that's a lot. And you're talking about, mental health, and there seemed to be so much emphasis of late, about the importance of mental health. And I believe that your approach and experience and education, right, has prepared you to really serve people in a way that is so unique because you're coming from the medical side of things. And
Yes.
there we are on the other side, still saying, hey, we could make a good marriage here. And you have so much to offer. I can't
Praise
even begin
God.
to imagine,
Yeah.
what God is going to do if you just totally just be courageous, just be bold, because this is a lot. You have a lot of knowledge and also experience, because I think sometimes, as you mentioned earlier, people look at you and they look at all the successes. She's mid-20s doing so well, and now, I mean, you're older now. We're talking about you at your age, just the success, you were on this great path, and now at this point in your life, you're looking back and you're saying, I could help people not take all of these years being stuck
Yeah.
on meds. I can help you, you know, make another decision or go in a different path that would probably be much better for you. And I mean, I can just only imagine how powerful your impact is going to be because of your specific formula, your life, your experiences, your
Right.
education. I mean, it's just amazing. It's beautiful. And so now you're in the program. You love the pre-class, the Runway to Soul program and stuff like that. Talk to us a little bit about who needs that message that you actually have.
Well, I think of two groups of people off the top of my head. One, um, in the program, we talked about who's the person that you think really needs to hear you. Who is this program for? So I initially said those people over the age of 40 because they're the ones that have had some depression. Maybe like me, initially it worked because studies show your best response is when you've never been on medicine and you're just starting out. Um,
Mhm.
those people who are burnt out, who are a little older, a little more mature, who are saying, hey, I'm taking medicine for this, I'm taking medicine for that. I don't want to just keep taking and adding medicines. When does this stop? I'm not
Mhm.
thriving as much as I want to or where I feel I should be. So I feel it's for those people who are on medicine and they're not thriving, they're doing counseling, and they're not quite where they feel they should be, or maybe they're ready to cut back or just explore some other things that may be beneficial for them.
Mhm.
As one practitioner explained to me, there are many tools to treating depression. And she's actually one of the people who talks about the other tools. She's
Mhm.
like, what you're teaching is a whole plethora of other tools besides
Mhm.
medicine, which is a tool, and besides counseling, which is a tool.
Right. And so will you be serving professionals like yourself? Because we know that a lot of persons who are in your field and in other medical fields and possibly even in other ventures like business and so on, who are highly stressed, there is a possibility of experiencing depression because you operate under so much stress that sometimes
Mhm.
we don't realize that it actually causes depression
Right.
because maybe we're overdoing it. So how do
Mhm.
you plan to help professionals like yourself, in the field? And I know it might be a challenge because nobody wants to raise their hand to say they have depression. Because my husband speaks on health, and I remember he would always give this joke, but not really, it's real, where he would say, how many people in the church are, are obese, like, obesity, have obesity issues, hands go up. How many hypertension, hands go up. He says depression, and everybody begins to look around them. It's
No one's
almost like,
putting up their hand, but they're all looking around to see who. There's so much
right, like,
information about it.
I just want to focus on me. So how do you plan to help
Yes.
professionals like yourself who would have, been so highly motivated, driven people, successful, but have to deal with that flip side because a lot of them are on meds? How do you think that there is room for you to be able to make a difference in that space?
I do. And thank you for reminding me. The other group of people, as I continue to work through this platform and speaking, are the busy younger professionals. We have a generation now that is different from years ago. They're they're more interested in balance in their lives and not just the dollar sign. They want to
Yeah.
be happy and fulfilled. So I think actually that this generation of younger, busy working people and professionals, they may be thinking, hey, I don't like this. I don't like this run, rush, metrics, burnout, stress. Where is this getting? Because I'm not happy. I'm not having time for myself. I'm not doing self-care. I'm not hanging out with my friends. I think that's another group of people who might appreciate this program, that they don't want to get to the point where they're totally depressed or they realize they're on that road and they want to start implementing some lifestyle changes now before they get to that point. Because COVID taught us, look what the stress happened. We heard suicide, we were shut down, we weren't able to hug and congregate anymore. What happened? People put on weight, people became glued to the TV, and you heard of just mental health professionals are still overwhelmed now from what happened when COVID hit. They are overwhelmed. It's difficult. So now we're seeing more online resources where people can sign up that way. Yes, because people realized that they were one stressor away from a mental health crisis.
Wow, that's crazy stuff. Man, I hope we get to have you, serving the country at large, in that space because of, your whole entire your makeup, because I think it's beautiful and you could really help people because you have a passion, for helping people experience greater health. And
Yes.
so you've been through the program, you're now at that space where you're going to be promoting yourself to be able to work with groups. How will you get out there? Because we have you here on Lunchtime. We're going to feature you in the magazine. We want to know a little more about, we want people to find you as well. And so we want your email address to put on screen. But tell them, why they need I mean, I believe we all by now know why we need you and the work that you're doing. But what would you like to say to just people who are listening who may feel, afraid and also ashamed as you would have felt that day when you were on that line, to get your medication, but also about just you and the work that you plan to do. Like what kind of programs are you planning to do? And then tell us where they find you and so on.
So I'm currently working on a program to guide people through learning the different strategies and techniques that I found that helped me move through my depression and get off of the medications. And now I'm back on one low dose because I got exposed to mold, another toxin, which affects your brain nerves. And I didn't realize that, So, but I'm doing so much better now because I have all these tools to draw on. And I'm feeling so much more clarity of mind. So I'm working on a program to help people guide them through the education of the why it works, how it works, and in digestible small pieces, because people who are depressed are often overwhelmed and they're exhausted. So it's hard to get them to implement a lot of changes. You got to give it in small doses and then see which combination works for them. So I can be found, you can email me at breakthroughdepression@gmail.com to book me for a speaking engagement at askdrandreathomas.com. And I'm also on LinkedIn, Dr. Andrea Thomas, and also YouTube, my channel is Breakthrough Depression, and also Facebook.
Awesome. Awesome. Now, Dr. Andrea, the thing is, somebody might be saying, but everybody not going to get off medication, or you can't just stop your meds. What would you say to
No, you
somebody
can't.
who's like, you cannot so they just cannot just stop the meds listening to you. They need to actually get in touch with you so you can probably give an assessment, etc. What's that?
Exactly. No, don't just stop your medications. We need to work with the practitioner that you're already working with and start to implement these things and see how you feel and monitor you, and together see if you can wean or just feel better implementing these techniques in addition to your medication. No, absolutely do not just stop them. You need to work on implementing the strategies and see what combination works for you or what's feasible with your schedule. You know, I want people to know there's hope. There's hope beyond what you're already doing, and there are other options. And it's not just medication and counseling are not just your only options. They are options. They help people. They save lives. But for those that need something more or are ready to take on doing other things to help their bodies be more healthy, which actually crosses over to help you with other ailments and just live your best, vibrant, healthy life, then this is the program that you should look into, or reach out to me and we can talk.
Absolutely. It sounds a lot like you have a holistic approach to dealing with depression.
Yes.
And I love that, because I think so many of us just think we just have two options. As you mentioned, we have medication. Most people don't even think about counseling. When you're depressed, people just think, let me just get the meds, right? And so you see, we have medicine. We also have counseling, but then you have a whole host of other options that you can probably implement that will not only help with the depression, help you with just an all-around beautiful, amazing experience as you're having in your own life.
Yes.
Now, I can't believe the time is going so fast and we're almost done. Before we get off today, what would you say to a woman who feels called, because you felt it, you took some time to make that decision? And I know there are so many women who have been reaching out to me, who have sent messages, who have had calls, and they too are delaying in reaching out. And now you're there, and I'm really honestly looking forward to seeing where God takes you with your message. What would you say to that woman listening right now?
I would say don't just think about it, pray about it, and book the discovery call with Dr. Collins and see how you feel after that. And if you have confirmation from the Lord, and think deeply about what's holding you back and why aren't you doing it? What are your excuses? What are your fears? And ask God to reveal it to you, and book the discovery call. And it's 30 minutes, and you'll have the opportunity to ask the questions that you want to ask. So don't hesitate, but take it in prayer, and God will guide you on what your next step should be.
Yes, awesome. I'm so happy for you, Dr. Andrea. Your work is needed. And remember, if you want to reach out to her, because you may need to, it's something that most people may not come to you if you're a leader within an establishment. And I can see you probably going into the workplaces, into the corporate spaces, because we have a lot of people, leaders, managers, etc., dealing with, the issue of depression, maybe through drinking alcohol and other ways, right? Only because they don't know how to manage it. So I believe that you are needed in a lot of spaces. It's now just trying to just really get into, I think the professionals and the professional space is probably for you, because it's in that space that some of us, we're probably a little too proud, because we're in charge of people, because we have these leadership positions. We're not really going to be able to just tell anybody I'm depressed. However, if you as a professional can go into these spaces and do, lectures and have sessions with people, maybe it might actually work, because this whole issue of depression, mental health is a challenge here in the US. And I know that your voice needs to be heard. And so we are so excited that you are being brave, you are being courageous and bold in just stepping out to address this, knowing that some may judge, some may, misunderstand even that passion that you have. And so, are there any last words you say as we say goodbye to our ladies who've been joining us for lunch today?
Two things. One, there's hope. Don't give up hope and don't give up searching. And I think it's Alcoholics Anonymous that has the motto, it works if you work it. So work it because you're worth it.
Amen. I love that. Work it because you're worth it.
That's
so
right.
The doctor just gave us something to keep us going all day. Work it because you're worth it. I love it. Thank you so much, Dr. Andrea, for joining us. Ladies, without you, there'd be no Lunchtime series. So thanks for joining us. Reach out to Dr. Andrea if you need her to come speak at one of your events so that you can actually help break the stigma in certain ways in speaking about depression, but also to help other people really experience a more holistic, healthy, not only mental health, but also physical and all over the place. So thank you so much, Doctor. We're so happy to see you. Awesome.